Hi, everybody. Welcome to this week's episode of This Week in Global Health. Thank you for joining us for our show. Today, we're going to be focusing on refugees and internally displaced persons, or IDPs, as we're going to call them throughout the show, and the effects of conflict and war on their healthcare systems. So just to go ahead and launch right into the topic, I'm going to introduce to you Jessica Taff and Katie Jackson, who are on our panelists today. We're short a Greg Martin, but he'll be back with us next week. And we'll go ahead, and today's topic is going to be a little more cursory. We're going to do a series of shows on refugee and IDP health, as well as healthcare and conflict, much as we did with our healthcare in danger episode a few weeks back. And so this is mostly to provide you with a context of the current situation, and in subsequent episodes, we're going to go more in detail on some of the problems and the solutions. So to get things started, I'm going to send it over to Katie. Katie, would you give us an overview of the current global situation regarding refugees and IDPs?
Definitely. So to start it off, a recent report released by UNHCR shows that the staggering toll that conflict, persecution, and war have taken on many populations around the world. The number of people forcibly displaced at the end of 2014 was 59.5 million people. This is up 8 million from just a year ago. So in the past 5 years, at least 15 conflicts have erupted or reignited in the world. There are 8 that have reignited or erupted in Africa, 3 in the Middle East, 1 in Europe, and 3 in Asia.
And these situations are awfully complicated to navigate. So in order to sort of give an idea of the international players, how governments, how non-governmental organizations help out, Jessica, how does the global community work to assist these affected people?
Okay, well, first you've got refugee receiving states. These are the countries that are the first to take in refugees and asylum seekers. And what they do for the refugees is they provide assistance with delivery of life-saving health and also other critical service. And they do this during emergencies, but also beyond the emergency after that disaster has gone away. And specifically, they are involved in including, they distribute relief items. They also build and improve infrastructure, and they also manage the costs of building and managing settlements, camps, or other accommodation for the refugees. Now, the next level of help that comes from these organizations like UNHCR, that like I said, those are the ones that come in after that first amount goes in, and then they're there to provide assistance to these refugees.
Yeah, exactly. I mean, the host countries, the neighboring countries, are the one who sort of bear, and I'm going to use the phrase burden, I don't know, this influx of people, and then once they sort of get settled within these countries who have opened their borders, then the humanitarian agencies come in to sort of assist. Now, both the refugees and the host countries often encounter problems or just difficulties in implementing and accepting the new population. Host countries often aid refugees for prolonged periods of time. I think that people often forget that refugees or displaced peoples are often displaced permanently. We've got some statistics from the UNHCR, and it noted that in 2014, only 126,000, almost 127,000 refugees were able to return to their home. This is the lowest number in 31 years, and as you heard Katie say at the beginning, that's 127,000 refugees out of the nearly 60 million displaced people or refugees that we currently have in the world today. Now, what this also means for these systems that are taking on this influx of people is that the refugees have to be integrated into the local communities and healthcare facilities in their new home. The measures taken by host countries incur significant financial burden, and this is economic and social costs across pretty much every sector, from shelter to health, education, water, and just the general overarching infrastructure of taking on this many people at a time.
That's a really good point. Sorry, I was like trying to find my mute button. So that's a really good point, Chris, when you made the comments that people don't always return. So actually, I'm based in Sweden, and Sweden accepts a lot of refugees each year, quite a lot more than a lot of countries in the world. And the problem actually then is people come in and they have to learn Swedish in order to live in Sweden, and a lot of people don't learn Swedish. And the question is, though, well, why not? And a lot of people say, oh, I'm going to go back home. Like a year here, 2 years here, and then I'm going right back. So I think it's really interesting that you mentioned that, because I wouldn't have thought of that either. But when you're forced from your home, it's still where you, like, the place you know, and so you're hoping and wishing that the conflict ends soon so you can return to your life there. You don't necessarily want to. It wasn't really your choice to set up a life elsewhere.
Absolutely. And to speak sort of anecdotally from some time that I recently spent in Ukraine, there's a lot of people who are stuck in eastern Ukraine in the conflict zone. And there are millions of IDPs spread around the country. But one of the big issues is people who are still stuck close to that conflict territory. And a majority of them are the elderly. They're people who this is the only home they've ever known. They're very reticent to leave. And they don't have anything outside of that. You know, where would you go if you were 75? You had very limited access to medications, and you were supposed to resettle, but you didn't have anywhere to resettle. So for those who do leave, they often think that they might hopefully be going back to the home that they left, and that, as we've now heard, is generally not at all the case.
Right.
And then, Katie, there was another comment that you actually had on sort of what happens to the refugee populations, you know, once all of the governments or all of these humanitarian organizations begin funding these programs for those who join.
Right. So I think that it's really often that it causes resentment with the pre-existing local communities who see these newcomers an additional drain on their limited resources. I know it definitely happens within Sweden, particularly in countries in Africa, Asia, and the Middle East, who are already stretched beyond their limits. Today they host 86% of all the refugees in the world, so definitely a place that already has its own demands, and accepting more newcomers every day is definitely putting a strain on the system.
Absolutely. And then, I mean, to sort of gear it back towards access to healthcare and things along those lines, Jessica, how is healthcare access and delivery more specifically affected?
All right, well, you have to remember that all displaced people, whether they're internal or external, they've got health problems that are associated with the fact that they don't have access to the healthcare that they usually had before. And this includes housing, water, sanitation, and all of these things have implications on their health. So the idea that they're stateless only exacerbates these risks, and often a lot of these health needs, or just basic human needs, can't be met.
Absolutely. And there was a talk by our friends over at the Young Professionals Chronic Disease Network that aired last week, and they had on a physician from MSF, and I'm completely blanking on his name now, but he spoke on NCDs and humanitarian action. One of the big issues he was talking about is, as we mentioned earlier in the show, there's a lot of existing conditions and problems that people are having a hard time managing before they even deal with the conflict itself coming on. So we'll include the link to that in the show notes on our website for those of you who want to check it out. It's about an hour long. It's really fantastic. It goes very in depth in the challenges faced with setting up like NCD policy and things like that in times of humanitarian crisis. But that also brings me to sort of an interesting question for you guys. Now, we know that crisis and emergencies and times of war disrupt a system, you know, completely. And we all work in different areas of health and have different interests to that respect. Now, what do you think some of the biggest problems, especially given our backgrounds, what do you think they will be with access to healthcare or just healthcare in general? Like, I know for me that propensity to think about NCDs, I think a lot about the mental outcomes, or I'm sorry, the outcomes of mental illness. You see a lot of PTSD, you see a lot of children getting more aggressive just because they don't know what to do, families in crisis, and then there's even more depression and anxiety because a lot of people who relocate are vulnerable to persecution and xenophobia and many of the problems that come to moving to a place where you may or may not be welcome. What about you guys?
I think it's really easy to, like you said, the chronic diseases. I think it's really easy to forget that when a health system crumbles, or when you have moved from a health system, let's say you moved to another country and you're not in the system yet, those things that you regularly rely on, and as simply as like a doctor's checkup, or as seriously as like diabetic medication that you regularly need filled, that disappears. And I think that's really something that we overlook. I was also going to mention about maternal health. So, you know, if you're, you know, pregnant and you're about to give birth and you're not in the place you normally are, what does that mean? Where does that exist? And even along the lines of mental health, again, Chris, after the Haiti crisis, they were saying people were just like sitting around, and when you don't have a daily routine, when nothing dictates what you do during the day, people go a little crazy. And I think I would as well. Like, you need to have, like, we get up for a reason, and I go to the go to the grocery store for this time, and then it's lunch. And when you lose that that schedule that is based around having a life in a place, it really has mental repercussions.
Yeah, I think to quickly go back to an episode where we were talking about Ebola, I think, Jessica, that was one that you put together. We saw some statistics on the fact that now that people were too scared to go to school and certain things, there were affected communities where rates of young or child prostitution shot up because people didn't have their routine. They were, sort of in a chaotic state, and so all of these we'll call them negative responses started happening socially. Now, as far as your take on these big issues and access to healthcare, Jessica, what do you think?
Well, I naturally think infectious diseases because that's my first go-to. But yeah, there's a lot of things that, and we've seen it in other crises, whether they be conflict or whether they be natural disaster. Especially in natural disaster, you've got an assault on the infrastructure of these communities, and let's just think with Haiti, you had all these infectious diseases due to the poor sanitation conditions and the influx of water into these areas and the damage that did. So you have a lot of waterborne diseases that are a problem. The other thing is that, like we've seen in Syria, that this has caused resurgence of polio because immunization has not been kept up. So really, like you guys are mentioning, that there's this stop on healthcare services, and this is across the board, and it affects both non-communicable diseases, communicable diseases, and the other part that we need to think about is that even if it is after conflict or a natural disaster, there's infectious diseases that are due to poor crowding conditions and things that are, so there's all of that.
Tuberculosis and things along those lines.
Opportunistic infections, right?
Yeah.
Well, we've even. Oh, sorry. We've even seen the outcome of the Ebola outbreak, that there's a number of. They were saying something about the fact that because all of the resources had been put towards quelling the Ebola outbreak, which obviously rightly so, that there was now this huge damage done by all those resources being directed away from malaria. So that's just definitely something to keep in mind. It's like it doesn't matter what kind of crisis, and a lot of times it is conflict, and sometimes it's just emergency or disasters. This is very pervasive, and it affects every aspect of healthcare delivery. Now, if I can, Jessica, I want to take it back over to you for the science update. You found a great article, a research article for us today, and I'd love for you to share it with everybody.
Right, so we were talking about infectious diseases and how this affects refugees. One of them that affects refugees is hepatitis B. And it's not so much as it affects refugees, it's just that in a lot of countries where refugees are coming from, hepatitis B is highly prevalent there. And so this spring, the journal Vaccine published a cost-effective study on the screening for hepatitis B versus screening for hepatitis B and then vaccinating or managing the disease versus just vaccinating without screening. So like I said, many refugees are at risk for hepatitis B because it's in their country of origin, or sometimes they're going to a country where it's highly prevalent. Now, hepatitis B is a chronic disease that results in severe liver outcomes that become increasingly so as the disease progresses. Now, not only are these severe liver outcomes, but they're also really costly to manage. So this is why the authors were kind of wondering, is there a way that we can, what is the effective, how should we be dealing with this, and what's the most cost-effective way? So the authors used data from refugees that came to the United States between 2005 and 2010, and they went to Minnesota and Georgia. And then they compared the costs and benefits of screening overseas and then vaccinating and managing the disease, or vaccinating without screening first. And they found that screening was more cost-effective because the benefits of catching the disease early and then managing saved later costs by preventing more of the serious sequelae, including death, which obviously is going to have more costs associated with it.
Absolutely. It's all about prevention. This is what we're learning. Prevention and vaccination. We've done shows on those too. Now, Katie, we've got a couple of really interesting positions that you found for today's Katie's Career Corner. So if you would share those with us, that would be great.
Definitely. So today on Katie's Career Corner, I have 3 positions, and I'm just going to mention them quickly. 2 are from the International Rescue Committee. One is a partnership coordinator in Liberia, and that's kind of working with local community groups, which I thought was really interesting. The second one is a health information systems and mHealth specialist based out of New York. And I have a few friends that are in mHealth, and I think it's a really interesting and new field, and very nice to see that it's being applied to the International Rescue Committee and emergency and refugee healthcare. The third position is actually in the International Organization for Migration. It's actually a local posting, so you do have to speak Danish. It's based out of Copenhagen, but I thought the position was really interesting because it's a project assistant in a program that is talking about reintegration. So we talked about displaced people kind of leaving the country, and this is about kind of working with displaced populations in Denmark and making sure that they settle well and things like that. So I thought that was really interesting to see that there are two sides of it. It's not just about people leaving, but where they go and how they integrate.
Yeah, we actually have a new TWiGHteam member who's worked a lot with refugees down in Australia. Her name is Sarah, and she was talking about, she worked as a volunteer program, which was actually teaching people life skills. You know, teaching especially the young children who end up fleeing and then moving to Australia and don't have parents or don't have other resources. Basically teaching them the basic essential skills of, you know, like paying a bill or the things that most of us wish we'd actually learned when we were younger.
Being an adult's tough.
It is very difficult. And then I just want to throw out one really quick news story that I found on CNN this morning. There's actually a lot of coverage because the UN has released a report talking about sort of the migration issues. And so the UN says that 137,000 migrants and refugees made the journey by sea to Europe between January and June of 2015, which is an 83% increase. So this year it's 137,000. Last year it was only 75,000. And a majority of these refugees were from Syria, escaping the conflict, as well as Afghanistan and Eritrea. So again, fleeing the persecution, and that's some data from the UNHCR. So everyone get to Twitter or get to your news outlet and read a little bit more about what's been happening with the migration issue. On that note, if you have any questions, if you have comments during the show, anything along those lines, please be sure to email us at hello@twig.org. You can also look at the jobs, all the resources, articles, anything that we've mentioned today on our website at TWiGHteam.org. We are on Instagram, we are on Twitter, both are at TWiGHteam at TWiGHteam. And we also have quite the obnoxious LinkedIn presence. So you can find us there at any given time. Again, thanks for joining us. Thanks for joining us today. Oh, Katie's smart and put up all of the visuals for that, in case I spoke a little too quickly. We also have our YouTube channel. You can watch these shows live. You can also watch them after the fact, and they're all archived on the website and on YouTube. Thanks for joining us for today's show. We are happy that you had an interest in this topic, and please stay tuned for future episodes where we'll be going a little bit more in depth on IDP and refugee health. Everyone have a great afternoon. I forget how Greg signs off, so I can't do that, but we will see you guys next week.